Hi, everyone. Thanks for joining. We're going to wait for people to get on and then we'll get started. Hi, everyone. Welcome to today's webinar. I'm Seth Grossman, the Vice President of People and External Affairs here at AU, and we're pleased to be with you today. Today, we're going to discuss a variety of matters related to our shift to a new way of working at American University, including our transition to a hybrid workplace environment and the health and safety measures that will be in place as we return to a greater physical presence in the fall. As you may have heard us say before, August will not look like February of 2021, but it also won't look like February of 2020. AU is moving to a new way of working, evolving to a hybrid workplace that involves a much greater mix of on-campus and remote work for our workforce. And we're approaching this evolution very intentionally, incorporating the lessons we've learned over the last year, feedback we've received from staff and faculty from across the university, and best practices from other universities and others' workplaces. As we move to August, we know that the university operations will be much different than they were over the past year. We will have a nearly full residential and classroom experience for our undergraduate students. Many of our graduate and professional students will also be back on campus and living in DC, while others will be across the country and across the globe in our online programs. That means that what may have worked over the last year when the university was almost fully remote may not work in the coming year. And as we move to this new way of working, we're committed to supporting our teaching and student experience for our students, as well as our research and service missions, and our evolution to the new way of working will reflect this. As we make this transition, it will require all of us to contribute to be successful. We're excited that the university has been able to bring back several critical programs to support our workforce, including the return of the retirement match 1 month early and the return of the merit increase program this summer. The choice to implement these measures reflect the university's strong commitment to our faculty and staff, and we think this is the right way to use the university's limited resources. But these choices also mean that we may not have resources for other valuable programs or measures, and we'll be continuing to evaluate these choices over the course of the coming year, and we welcome your input. Also, as we move to a new way of working, we fully anticipate that we will learn a great deal as the plan goes into effect. It is our expectation that these learnings will help shape the university plans going forward, and so we'll all need to be flexible over the next several months and indeed over the next year. And I know we can all do it because of how the AU community rose to the occasion and was so flexible over the last year as we navigated all of the challenges facing the university and our larger community. We know that you have many questions about the plans for our shift to this new way of working and the health and safety measures that will be in place for the fall. So today we are going to attempt to address as many of those as possible. We've received several questions in advance, and you can also add questions through the Q&A feature on this webinar. For those questions that we are not able to address today, we will seek to provide answers for those online through our FAQs. For today's session, we're first going to hear from Fanta All, Vice President of Campus Life and Inclusive Excellence, and Deidre Johnson, Senior Director of Employee Relations and Recruiting, about the health and safety measures and matters related to the vaccine requirement as we prepare for return in August. We're then going to hear from Matt Bennett, the university's Chief Communications Officer, about the resources the university is providing for more information about these measures and how you can access those resources. We'll then turn to Beth Muha, Assistant Vice President of Human Resources, and Ann Joyner, Executive Director of Total Rewards and Service Delivery, to discuss the university's move to the hybrid workplace and the timeline and policies for this upcoming transition. One note we wanted to share, we will be recording this session and sharing the video so that it'll be available to those who are not able to attend today. Thank you again for joining, and with that, I'll turn it over to Fanta.
Good morning, everyone. Thank you, Seth. Thanks to all of our colleagues who've been able to join us today. And we know that there are many who are doing what they need to do, which is take their vacation time. And so this is one of the other reasons why we wanted to record this session. As the Vice President for Campus Life and Inclusive Excellence, part of my role during the COVID response has been to be on point around health and safety. And Dan Nichols and myself are the lead people with the DC Department of Health and with different stakeholders externally to make sure that our health and safety protocols continue to follow best practices. As Seth mentioned, we know that you have many questions. And so I want to kind of almost jump into my presentation by answering some of the questions that you have submitted in advance. And so let me first start with just making sure that we're all on the same page about where we're going in the fall, because there's been many questions. First and foremost, we will maintain the academic calendar for fall 2021. And so that is not changing. Also, again, you've heard before that in-person instruction on main campus will return for the fall classes. And Academic Affairs is working on the courses that meet the threshold for online courses, and more information has been shared with the academic departments. Our residence hall will reopen fully this fall, and I can assure you that we will be with full occupancy, given both the interest from students and families to have their students be back on campus. And all of our academic and administrative and athletic buildings will be reopening this fall. I know many of you have asked the question, will it be at full capacity? And the answer is yes. We will be at full capacity for our many spaces, whether it's the academic classrooms, whether it's the event spaces, whether it's our athletic facilities, with some mitigations in place. There will be some exceptions that we'll put in place as we get closer to the fall. And we'll continue to, on a daily basis, follow the guidance that's being provided and keeping abreast of developments that are going on around health and safety. Also, travel, university travel, business travel will resume, but there will be protocols in place for approval of business travel. And Dan Nichols and his team and others have put in place those measures, and you'll be getting further communication about what the approval process will be at the school level and at the department level as well. So more to come there. And our food services will be reopening as well. So I think the first and most important message is we are going back to the calendar. We're going back to having our spaces open. We're going back to having our residence hall open. So you may be asking yourself the question, is that a wise choice? Is that a wise decision? And there are many reasons why we're moving in this direction. First and foremost, I think you've all received the notice that the university has made the intentional decision to require vaccines for staff, faculty, and also students. And we know, and we've been following much of the discussions, but also much of the research around vaccine and vaccine efficacy. And we believe deeply that the way forward to better and more efficient health and safety is to have vaccine and to have the vast majority of our community vaccinated. And there's some data points that I want to share with you. Yesterday, we sent out the notification that the vaccine attestation for staff and faculty is ready, and that you should please proceed and fill out the vaccine attestation, and that for those who are requesting exemptions based on medical and or religious, to go ahead and follow that process. In less than 24 hours, we had already 880 people who had completed their vaccine attestation within less than 24 hours. But that's not the most important data point. We also know when we conducted a survey of staff earlier in March, April timeframe, and we asked this question about how many among our staff at the time had already gotten vaccinated and or were planning to get vaccinated in time for the fall. We had 70% who had already been vaccinated then, and we had 19% who indicated that they would be fully vaccinated in time for the fall. That is incredibly encouraging news, because it literally puts us almost at the threshold of 90%. Do we believe that we can reach the 90% threshold for vaccination for staff and faculty and students? Yes, we do. On the student side, we've already received over 3,500 submission, including proof of vaccines that have already come in. So we have more to go, but the vaccine is an incredibly important path forward. And it's a very important one for all of us to please make sure that we go ahead and complete those attestation as soon as possible. But we know that vaccine is not the only thing around health and safety, right? We know that also testing, questions have come up. What do you do about those who receive exemptions from vaccines because of medical and religious? The answer is they will have to follow health and safety mitigation guidelines that include daily screening. It includes masking. It includes testing, frequent testing as well, and we will be working with our colleagues and our students who fit those categories of exemptions. It's going to be incredibly important for us as a community to not stigmatize those who have gotten the exemption. And so it's going to be very important for all of us to be educated about that. And as a community of care, to exercise not only good judgment, but also to really make sure that we're not stigmatizing folks, because we don't know what might be some of the reasons for why they may not have gotten vaccinated, but it's important for us to keep that in mind. In addition to testing, we will also continue with our mitigation around contact tracing. As you all very well know, we've been doing COVID testing. Since we started COVID testing in the fall, we are over 40,000 COVID tests that have been administered. And for our folks who have been vaccinated, I know the questions on your minds are, well, what's the benefit of getting vaccinated when it comes to health and safety? Well, there are many, but first and foremost, we will be relaxing our masking policy for vaccinated folks, including in the classroom. We've gotten a lot of requests and a lot of sort of questions from faculty saying, I want to be back in classroom and I want to teach my students, but do I have to be masking when I'm in the classroom? And the answer will be no. Vaccinated, you will be able to teach without mask, and so will your students. That is one of the guidelines that the CDC and others have continued to provide, and it's been quite consistent. Also, this would mean that there would not be the need for physical distancing in the way that we've been doing that. And then it also means that testing will be a different testing. We will be reducing our testing of those who are vaccinated, but we will continue to do some level of surveillance testing of our communities, even those who are vaccinated. And you may be asking, well, why is that? The CDC guidelines indicates that that's not necessary. DC guidelines indicate that that's not necessary. Well, we want to be overly cautious. All of us are reading about these variants, and we've already read up about the Delta variant and the level of transmission of the Delta variant. It is incredibly important for the community that we are, and given gatherings and everything else, that we continue to be very careful and that we continue to know and understand what is the level of the virus within our communities, both in the DC area as well as at American University. And so if we see that case counts go up in DC, then we will reinforce testing. If we see that case count go down, then we'll continue to relax our mitigation strategy. But here's the most important message. Vaccinated, masking will be relaxed, physical distancing will be relaxed, testing will be relaxed. Those who are not vaccinated, we will want to make sure that we help in protecting them as well with more testing, with masking and other mitigations in place. So what does this mean? It means that yes, you'll be able to return to your offices. It means that yes, in coming to your offices, you'll be able to meet with others in your office. It means that it doesn't have to be masked, but also it's incredibly important for all of us to continue to really exercise grace. And how do we exercise grace? Some of our colleagues, as they're transitioning back, even with all those measures, understandably so we're going to be anxious about coming back after 18 months of, in many ways, having to be on lockdown and everything else. And so some of us will want to still opt, even vaccinated, to wear a mask, and that is perfectly fine. And so in those instances, you may want, if someone is in your office, to ask them to please wear their mask, and we would ask that people respect choice and that we respect that for our colleagues, and that we accept those choices as they come up. Does this mean that you'll be able to come back to your offices? Yes. Does this mean that you have to come back to your offices? A lot of it is going to depend on what the work modality is that has been, that will be in place. In some cases, your students may want to meet with you in person. In others, they may prefer virtual. And so there'll be more coming about how that will work as we move into the semester, as we move into the summer, and there'll be more information forthcoming. We strongly will continue to support that meetings that are regular business meetings continue to be virtual. One of the things we've learned about COVID-19 is how we're using our space. And we really cannot, given how limited we have our spaces, to have 80% of spaces being taken up by regular business meeting. And with folks who will be, in various work modality, it's going to be important that we remain virtually for regular business meetings. But does it mean that periodically you may decide to have instead face-to-face meeting? Yes, we will allow for that, and we'll want to have some flexibility. Some of you will want to have your retreat in person because that's important for how you build community. Others of you may decide you're going to have your first major meeting in person, but then everything else is going to go virtual. Or you may decide that your last meeting, which is your last meeting of the semester, that you prefer to have that in person, and in which case some exceptions will be made. But by and large, we're asking that our spaces be really reserved for classrooms, that they be reserved for students to be able to use our spaces, and that they be reserved for major campus events where we'll continue to have those events hosted at the university. And so that's going to be important for all of us to do. Density, there will not be much requirement for density. We will continue to monitor that. Clearly, if we have visitors that are coming that are not part of our community, we'll ask that they conduct daily screening, and anyone who's not feeling well with any kind of COVID symptoms will continue to be asked to remain at home and to not report to any event. We will also request that those who are having events that are open to not just the AU community, but to guests outside, they will have to maintain a registration of guests, including key information, so that in case we need to do contact tracing of any kind, then we'll be able to have easy access to that information. So all of that will be put in place in terms of measures. Cleaning facilities, air quality, we get those questions a lot. And again, let me reassure you that when we were planning to come back last fall of 2020, ahead of that, our facilities team really was very proactive and went and did a full audit of each of our buildings to ensure that the air circulation, the air filtration was exactly what it needed to be, not only in meeting CDC guidelines, but in many instances, exceeding those guidelines to meet industry standards for COVID-19 response. And that is not just our academic building, it is not just our residence hall, it is all of the AU-owned properties, whether it's Spring Valley Building, WAMU, whether it's 3200 Wisconsin Avenue, the law school, all of our buildings have been audited for that, including the center, the Child Development Center. And so they have provided a sort of a full holistic analysis of this. And so we're going into the fall knowing that we are not only meeting, but in many cases exceeding what have been the standards set for air quality and air filtration. So wanted to make sure you were aware of that. Cleaning, we will be going back to our cleaning protocols for the fall, in that the main areas will continue to be clean. We are responsible for our individual offices the way we've been responsible for our individual offices before, whether it's the kitchen that we're in our respective areas, etc. There's been questions that have been asked, will classrooms be clean in between classes? The answer is no. That is not a standard that is being established as necessary. And so we will continue to have high standards for cleaning, but I wanted to raise that. Classrooms, again, I've already talked about the fact that our classrooms will be at occupancy for the rooms, and our offices will be at occupancies for the room. For those who will need specific adjustments, you will be working with human resources if you have a shared space and there is a need for that. But again, in many cases, because of the vaccine rate and because of those requirements, in addition to other mitigations, we will be back to many of those standards, and we will continue to monitor and will not be afraid to adjust as needed. So with that, I'm going to have my colleague Adidra talk about the accommodations for vaccines.
Thanks, Vanta. Can you go to the next slide? Thank you. So for those employees who are requesting an exemption from the vaccine, they'll need to complete the COVID-19 vaccine exemption and workplace reasonable accommodation form. So when you go to the attestation form, if you select that you have not been vaccinated or you're not getting vaccine, at the end of that form, it will take you or prompt you to this exemption workplace accommodation form for you to then fill out kind of the next steps. You'll be able to choose between two options, that you're requesting an exemption because of religious reasons or because of a medical condition. If it's because of religious reasons, you will select that, and those requests will come to us in employee relations, and we'll review those, and a notification will go to the employees about the outcome of that request. If you request an exemption due to a medical condition, they will also come to employee relations, and we'll work with Prudential, our insurance disability services, to review those. And again, you'll get a notification about the outcome of your request. For regular or workplace reasonable accommodations, you will use that same form. So you could have an accommodation based because of the vaccine, or you could just have a regular workplace accommodation that you want to request. You use that same vaccine workplace reasonable accommodation form. We will, in employee relations, be working with Prudential Disability Services again to assess the medical information. Prudential will give us an evaluation and determine whether or not that disability is a disability under the ADA, and then determine what accommodations are appropriate. Employee relations will engage in an interactive process with Prudential, with the employee, to determine those accommodations and explore all options. I do want to make sure everyone understands that that medical information will be kept in the strictest confidence. Only designated staff and employee relations will have access to that information. I would also want to remind people that the accommodation process is not set in stone, so there may need to be reviewed at times if the disability changes or if the needs of the department changes. Also, if someone has submitted medical documentation previously to Prudential, maybe last year or last fall, as they were going through an accommodation process, we can use that documentation and that information with Prudential to expedite the process. Again, employee relations will be sure to notify everyone about the outcome of their request, whether it's an exemption or it's a reasonable accommodation. I do want to just note that generally accommodations will not include remote or telework for duties or positions that require campus presence. We'll explore all types of accommodations. So they could include enhanced safety, protective measures, other modifications, looking at the work site, the workspace of the employee. So we'll really go through all of those different options to see what will work with the employee. And also, the ADA does not require employees to accommodate an employee without a disability based on the needs of a family member or other member of the household. So if an employee is in that circumstance, they should really explore their options under FMLA or other leave options if they feel they're unable to return to work because they need to care for a family member or a household member. So for example, if an employee does not have a disability, they're not entitled necessarily to telework or to work remotely as an accommodation in order to protect their family member from a potential COVID exposure. In situations like that, they want to use FMLA or explore other leave options. Employees can certainly reach out to employee relations in those situations, and we can help you through the proper process.
Andrew, I know there's several questions. I've seen them. Would you like to facilitate the question segment of this?
Absolutely. And what I'll add here too is we're seeing a lot of questions, and we definitely won't have time to get to them all. But what we'll do is we'll ensure that these questions are added to the FAQ page, just so there are answers received to all of these. So one of the first questions, Deidre, I'll direct to you. How are we working to fully understand the needs of folks with disabilities or with chronic illness on campus, and what are we doing to support that community?
So we will, as we get these requests, employee relations, there's a team of us, we're focused on this. We understand this is an important matter for individuals, and it's a timely one. So if people have requests, feel free, you don't have to wait. You can submit your requests now. So we have the time to evaluate them and review them. We're working with Prudential, who has experience with this. They will collect the appropriate information. They will help facilitate any information they need from medical providers and give us recommendations. And then the really important part is really engaging in that interactive process. That's where we really understand the needs of the individual, where we can really figure out and explore what some options are. You know, there are times when people come to us with certain requests, and then after going through that interactive process, we find there's other accommodations that would be even more helpful for employees. So that interactive process is really important in helping us understand the needs.
Thank you, Deirdre. Looking at the question, or Fanta, looking at some of the questions that we have around the air filtration system in the buildings, are the changes that have been made permanent, or are they only temporary while we're in a pandemic?
No, they are permanent. These are air circulation and air filtration that the facilities management has upgraded on, so they're not meant to be, let's just have this for the fall and then work our way differently. So that's what those are.
Thank you, Fanta. And looking at events now, is there going to be additional guidance provided around inviting external guests to participate in events or inviting external speakers? And then how many people will be allowed from external audiences as opposed to, AU affiliated guests?
So great question. There will be more guidance provided around external visitors and external guests. And in terms of the guidance for health and safety, we'll be following the protocols that the CDC and also DC Department of Health have. Again, you'll notice that with a lot of the protocols, much of it is premised on vaccinated and not vaccinated. For us, with the guests that would be coming in, we will ask for daily screening. We'll ask that folks who doing their daily screening have COVID symptoms not be present, et cetera, and so forth. We will be working very closely with the event schedulers and event planners in the different units to make sure that we're following those different protocols. So there'll be much more guidance provided, Andrew, around that. What we have also gotten, and this is, I think, important for us to keep in mind, right, is that, and I get this question a lot from folks, they're like, okay, I'm vaccinated, but this other person is not. The risk to those who are vaccinated is incredibly low. The risk is to the person who is not vaccinated. And so one of the reasons we went with the requirement is because if in fact we reach a threshold of 85, 90%, even for those who are not vaccinated, it reduces the risk significantly for them because of the fact that we have a large number of our community who are vaccinated. But with that, we still will be following some additional mitigation strategies around health and safety as we move forward. I also saw, Andrew, that there were lots of questions about that they were surprised that when they went in to do the vaccine attestation, it did not require documentation. And for students, it is requiring that. First of all, for students have been used to vaccines and getting the vaccine requirement. From MMR and others, we have systems in place for that, and we've always collected documentation for that. For staff and faculty, the vaccine would be considered medical documentation and would have to be preserved differently, as Deidre mentioned. And also we're going with the important premise that we will, there is a trust factor here. And I realize that there's a trust factor in attestation. But again, this is about one's personal health and community health. So we're going with that, with the attestation, but we do reserve the right, if need be, to request verification of vaccines. And there will be instances where that may come up, right? And so I want to make sure that everyone is aware of that. It's important for you all to read the directives around vaccines that are accompanying the vaccine attestation as well.
Thank you, Fanta. Yeah, that was definitely on the list of questions to ask, so I appreciate you proactively addressing that one. When looking at the guidance around wearing masks on campus, can individual offices or individuals have different standards in terms of mask wearing? For example, if one office wants to take a more strict approach that masks are required at all times, is that possible?
Andrew, that's a great question. And we will want to feel that because we really do need to make sure we create a little bit of a balance there. And we also really want to make sure that these are not individuals' decisions that are being made and that they're really predicated on health and safety. And so again, as I said, it's important for folks to have choice, but it's also important that as folks are frequenting our various offices, that we have at least some guidance and some standards around that. And so that's going to be important. And let me give an example. It may very well be that in an office or so where we have a number of unvaccinated people, that it may make sense, from not only an equity perspective, but to ensure that there's not stigma, that office as a whole decides to adopt a masking, sort of strategy. All in all, as Deidre said, it's incredibly important for us to keep the privacy of our colleagues who may, for medical reasons and other reasons, may have the exemptions. So to say more conversations to be coming, but what we want to avoid is folks, individually making a decision that has implications that is wider.
Thank you, Fanta. Another question that we're seeing pop up in the Q&A a lot is around folks who share offices. It's very, very difficult, if not impossible, to socially distance. And how will AU plan, excuse me, to mitigate that added risk in shared office spaces?
So Andrew, again, if you look at CDC guidelines and you look at DC, Department of Health guidelines, physical distancing is one of the ones that has been relaxed, right? Based on vaccine status. And so part of the answer is really the vaccine rate, because in some of our offices, it will not be needed in our interactions within our individual spaces. And so that's another thing that we will be providing guidance on. At the end of this meeting, Matt Bennett can talk much more about that, about some of the resources, but we'll be putting out more resources around some of these things, and we'll continue to update them as we speak. And in cases where it's warranted, human resources will be working with those departments, and the folks who are the head of those units will be looking at what are additional mitigation strategies, whether it's staggered work time, whether there's another place where a colleague can work out of, et cetera. Those will be some of the ones that will be put in place. But as we put those in place, again, we want to make sure we're following the larger guidance that is being provided.
There's a lot of questions in the chat around the safety of the vaccine, especially because it's still under emergency use authorization. So folks want to know more about the decision process that went into requiring the vaccines, and just about the general safety of taking the vaccine.
Andrew, I will invite folks to go to the CDC website. There's a lot of information about this around the vaccine efficacy, the research that's been done, et cetera. And yes, we will have folks who will be in many ways still hesitant about that. And I'm very, very aware of that. Many of us are very aware of that. But if there's one thing that we also know, as we see the Delta variant, and we see around the country where the Delta variant, the transmissibility rate has gone higher, we see the significant difference between those who are fully vaccinated and those who are not, in terms of both those who are falling ill, severely ill, as well as those who are being hospitalized. And we're seeing that the data shows that we're seeing an increasing number of young people who are being severely ill and who are being hospitalized because, again, of access to vaccine. And so to go back to this question, the decision was not made lightly. We as an institution and we as a community had to determine what is the best path forward for health and safety, knowing that there will be some disagreement around that. But I think for most of us, we very much understand and believe that the vaccine is an incredibly important path forward. And the research continues to indicate that.
Thank you, Fanta. I think it also helps that we have a former HHS leader in our midst, so that I think gives a lot of folks a lot of confidence as well. When it comes to, sorry, I lost my place. Give me 1 second. When it comes to kind of sharing space, especially with some of our academic advisors and others who have confidential conversations with staff, considering that everything is kind of going to be up in the air as we figure out office space and arrangements and sharing offices and who is in which office on what day and all of that. Is there going to be any sort of guidance around kind of how to have confidential conversations in kind of a new kind of flexible environment?
So that's really not a health and safety question, right? That's really a question about, the question that's being posed, are questions of how space has been distributed and how that would look like in a hybrid work environment. There certainly are guidance about, how we'll be able to maintain, how do you maintain a vibrant hybrid work environment, including the ways in which perhaps, confidential conversations and everything can happen. But I would say that based on the question, at least the way it's posed, it's not a health and safety guidance as much as a larger guidance about confidentiality. And I'm assuming the question, for example, is if I'm going to be working remotely, and normally it would have been in the past that I would have been in an office, a private office with a student having a confidential information, how would that work? Well, what that would mean is the student that you will be engaging with will need to be in a private space so that their confidentiality can be maintained. And we would expect that for you working at home, you will put in place the measures so that your communication and your engagement with the student is still maintained in terms of confidentiality wherever you are located for that conversation. So we'll be looking at things like, are there spaces that we need to dedicate where students can go to for confidential conversations, whereas before they would have come to maybe an advisor office? And then there's a larger question. Could that advisor office be available to that student when they're not using it, and so that they can have that appointment in that way? Those are all conversations and discussions that would need to happen, particularly for student-facing units that have confidentiality to maintain.
Thank you, Fanta. I'm seeing in the Q&A a lot of concerns about folks who are vaccinated intermingling with folks who are not vaccinated, and kind of how do we, is there a way to kind of differentiate who is vaccinated and who is not? And a lot of that obviously relies on personal responsibility and things like that, but is there a way to just kind of verify that somebody hasn't lied on their attestation?
Andrew, it's a great question. And I have to ask a larger question about this. And that is, what is the concern? Is the concern for the vaccinated person? Is the concern for the unvaccinated person? Is the concern that we're trusting too much our community? I would like to understand a little bit more and unpack that. Because again, let me reiterate, the real risk is to the unvaccinated person. And let me also be clear, we will not be that community where people will have to wear a badge that says, I'm vaccinated and I'm not vaccinated. That is not the kind of community that we want to be. And part of the reason is because, again, as we said before, some folks have very legitimate reasons for why they're not vaccinated. And they will be very much in the minority in our community. And my question is, do we want them to show a badge saying they're not vaccinated for medical reasons and so forth, so that we have peace of mind that we know who's around us? I don't think that that's where we want to go. So I want to dig deeper into what is the concern and how can we alleviate some of the concerns without stigmatizing, and also, frankly, for us to really come into a community where there's trust. Because some of what we're talking about, some of our folks are going and they're doing shopping, they're going to do their daily activities, and they're going to be among folks who are strangers and they don't know necessarily their status. And my question to them is, are you wearing masks all the time when you don't know who you're among? That may be part of the answer. But one of the things that I do want to begin and set the context for is, it's going to be incredibly important for us as a community to really think long and hard about some of this, and to continue to grapple with it, and to ask ourselves, what is it that we're trying to accomplish, and how can we best accomplish that without creating divide between us and them?
Thank you, Fanta. And it actually looks like we're right at time. Like I said, folks, any questions that we didn't directly answer will get added to the FAQ page. I have been tracking all of these questions, so we are not going to let them go unanswered. So thank you for all your great questions. And Fanta, do you want to bring us to our next section?
Yeah, no, thank you. We'll ask Matt to just take 5 minutes and talk about the resources and where people can find additional resources, because we're going to continue to build that. And then we're going to move from there to having Beth and the rest of the human resources team do a deeper dive into the hybrid work modality.
Great. Thank you, Fanta, and good morning, everyone. As we've talked about all of these various topics, much of this information is available through a variety of resources. that are available on the website. And I just wanted to highlight a couple of them. Many of them, we've been using them since the beginning of the pandemic, and we continue to add to them as new information is developed. So the first is the COVID-19 resources page. That's american.edu/coronavirus. That is kind of the main landing page for this information. It has all of the community messages that have been sent throughout the pandemic, the FAQs, as Andrew just mentioned, we continue to update them almost on a daily basis, and we'll take many of the questions from this conversation and add them there. Obviously, the information about the COVID-19 testing protocols, et cetera. The new health and safety guide for the fall, which you'll see in your email today, is there as well. And again, that's for the fall. The summer health and safety measures are on the website as well. So that's a good first place to start if you're looking for information. The next place is the AU Forward portal, and this is where the forms are. This is where we're talking about the vaccine attestation form, the accommodation request form. For those of you who have been to campus and done the daily self-screening form, that's there. That's where you go, where you need to submit information. And the link there is help.american.edu/AU_forward. And then, and this will lead into the next section of the webinar, the How AU Works Fall 2021 page on the Human Resources site. This gets into all the information about the hybrid work environment, the implementation timeline, other questions and resources. And we're going to cover, Beth and others are going to cover more about that in the next segment, but that's a good website if you're looking specifically for information about the workplace. There are some links to that from the COVID-19 site, but if you're looking for more comprehensive information, that's where you go. Two things that are not on this slide that have been mentioned that I just want to reiterate. Number one, Fanta mentioned the communicable disease policy and the associated directives. That's an important thing to read as well. And if you go to the University Policy Library, that's american.edu/policies, and look under the safety and risk management policies, the communicable disease policy and the associated directives, including the ones that cover the vaccination requirement, are there. Very helpful resource to read. And then finally, and this is in most of the messages that get sent out, but if you have any questions, you can always send them to fallfeedback@american.edu. That email is regularly monitored. We take questions that are submitted there and add them to FAQs, certainly respond to individual inquiries, but that's another good place if throughout the course of your day and your work, you come up with a question that you can't find on any of these sites, you can certainly send it there and someone will get back to you. So lots of good information out there. We're always adding to it. If there's something you don't find, again, let us know through that fall feedback email address, and we will continue to update them. So that is that for resources. I think we're going to Beth next.
Hi, everyone. Beth Muha here, and Ann Joyner and I would like to talk a little bit about the hybrid work environment. Beginning in August, we will be implementing a new way of working, and it's called the hybrid work environment. And it's really based on lots of different inputs. One, when we surveyed staff, as trying as the last year has been with COVID, sort of a standout positive has been how much people have appreciated working from home. Not concerned about commutes and high productivity, and generally improved satisfaction over the last year. And so we wanted to take those positive aspects and carry them forward into the way we work this fall, but not just this fall, into the future as well. And so what that will mean for many staff whose jobs lend themselves to remote work, you will be able to work on campus some days a week and work from home others. From remote locations in DC, Maryland, and Virginia. We can talk about out-of-state staffing maybe a little bit later as we cover this important topic. But it really is intended to reinforce, support our commitment to increase staff satisfaction, the retention of our talented staff, and productivity. All positives and upswings in the last year, and we'd like to carry that forward into the future. It also then in turn supports our mission of teaching and research. You may remember that we introduced this directional idea. It was sort of a concept idea back in February when we had our last staff webinar. And following that, we put a group together that was made up of some HR folks, some OIT folks, Andrew from Staff Council, and others to develop a straw person plan that was kind of based on best practices. And hybrid work, certainly we're not the first to do this. And so we were looking to learn from other organizations that have gone before. And we put a straw person plan together and vetted it in the springtime over that sort of April, May timeframe. Many of you, like 65% of staff or more, responded to a survey that we did in April so that we could learn more of your experiences. Those were factored into the plan. And then I think in May, numerous focus groups were held, and you may have participated in those as well. The focus groups were helping us to really think through how to make this successful. What are the successful ingredients? What's needed to support this so that it's sustainable, not just this fall, but into the future. One thing that, our research tells us, and also what we've learned over the last year, we were all sort of thrown into in the middle of March of 2020, right? All working from home. Well, we have a bit of lots of experience behind us. And we've also learned that hybrid work is even going to be different than that, right? It's something we haven't done before. It introduces its own complexities that we haven't faced before, but our talented community certainly will overcome and advance in spite. And so what we do know is that it's going to take some intentionality. And so it goes beyond learning what your schedule is, what your modality is. We'll talk about those in a moment, and all working together to establish some new norms of working, expectations of working, structures for working to support the hybrid environment. We really, really feel some things. A, we have to be intentional. B, we have to be flexible. This will be new for all of us. As Fanta said, we need grace, we need good communication, more discussions, ongoing discussions about how to launch into this, as well as how to refine and improve over time. So nothing is going to be sort of set in stone, but a bit of a learning experience for all of us as we move forward. How it's going to work is every full and part-time staff position will be assigned one of 4 modalities. And those modalities will and they're based on your job duties and what the department needs and university needs are overall. So of course, one modality would be certain jobs, because of certain characteristics, and we'll talk about those today, will still require physical presence on a full-time basis. But many jobs will have a hybrid work schedule, and that will be the work, as we've noted, some days on campus, some days remotely. And once again, I just want to reiterate, the modality is for various and important reasons based on the needs of the university, the needs of the department, and what your job duties are. Our goal is really to make this very transparent. We've provided consistent guidance. We've provided guidance to departments so that they can consistently apply an approach for planning what each of the staff position modalities will be. Instead of basing modalities on personal preference, or sometimes you might have heard, high performers get sort of this modality over others. We feel that those sorts of ways of thinking and sorting through jobs create opportunities for modalities to be granted unevenly and possibly unfairly. And so treating and making these decisions based on job duties helps to sort of even the playing field and provide more equity. So our goal is to treat like positions in similar ways. Now, do know that other things like staffing levels and what the space is like in a building, or what the peak work periods might be for a particular department or school, factor in also. So it won't be everybody with the same title having the exact same schedule, but generally they will be in the same modality with similar work schedules, maybe some working a few days a week from home and others maybe more than that. You may have heard about the core day. That's something that after we got through with our vetting, our research, and we looked at the staff survey, we realized that we really would benefit from a core day. A core day is one day in a week where everybody in the unit would come into the office regardless of your modality. Now in the fall, we'll not strictly enforce a core day. So it'll be at the option of the unit based on space and decisions from the department head. But going into spring 2022, again, as this is a plan that will stretch into the future, the core day will be a day where we all in a unit, in a department, come together. Now that could be the whole department. It's, you know, it's based on the size of the department and then the needs of the department as well. So it could be the whole department, or in large organizations or large departments, it might be a team or a subgroup or a particular sub-department coming in on that same day. But the department head will determine that. And we are going to, again, be looking to have those core days in place by spring 2022. So what we learned is that like community cannot be replicated in our fully remote environment. We are a community, it's a hallmark, trademark of AU. And we really do believe, and staff told us in the survey, that the thing that really was degraded, if you will, the element that was lost in the work that was done remotely was this creating team, creating collaboration, creating relationships, particularly if you were a new staff member joining the university. You really couldn't get a feel for the culture and all the wonderful positive aspects of working at the university. So we see the core day as a way for people to connect in person, to build community, to encourage that social and spontaneous aspects of work, to strengthen our teams, and to collaborate in ways that you just can't do easily when it's virtual. Why don't I transition over to Anne so that we can share a little bit more about the thought process, the planning process that units are going through to determine what the modality will be for each of our positions.
Thank you, Beth. Hi, everyone. The 4 work modalities are full campus presence, hybrid 1 with 3 to 4 days per week on campus, hybrid 2 with 2 days per week on campus, and hybrid 3 with 1 day per week on campus. Each of the work modalities can be combined with flex hours or compressed work schedules. We've developed a process and criteria for all of our units to use in making work modality decisions through a fair and equitable approach. In general, staff positions eligible for remote work have similar characteristics, but those that are designated as full campus presence or hybrid 1 have a greater degree of those characteristics. 6 of the most essential characteristics that our units used in evaluating staff positions are the degree to which a position is responsible for face-to-face, walk-in, or scheduled advisory or customer service to students, faculty, staff, or external customers. The degree to which the position requires the use of equipment or tools that are only available on site. The degree to which the position requires a visual inspection of work in order to assess performance or ensure health, safety, security, or quality standards. The degree to which the position must have on-site presence due to licensing, accreditation, or other compliance requirements. The degree to which the position involves supervision of staff whose presence is required, and the degree to which the position requires direct supervision, including frequent check-ins and collaboration. Departments will use these characteristics as a guide to slot each staff position into one of the 4 work modality categories. There's no single rule or bright line on how much of each of these characteristics is required to draw the distinction between full presence or primarily remote. Departments may try an approach for a period of time. For example, they might try this in fall 2021 to see how well it impacts staff performance, satisfaction, and the achievement of goals. It's important to understand that the modality may change at some point in the future in order to meet university or department needs. But the intention is for these work modalities to go beyond just this fall and spring. This is our new way of working. We began planning our new way of work in early spring, and that was followed by vetting with the campus community, a staff survey, and focus groups. On June 1st, HR provided each department with tools and guidance for their workforce planning. We received the department workforce plans last Friday, the 18th, and we're in the process of reviewing the department plans to ensure equitable treatment for similar positions. And we'll be providing feedback to the departments sometime between now and July 1st. Departments will finalize their plans by July 12th, and employees will be notified of new working arrangements by July 16th. The transition to on-campus presence within new hybrid workplace modalities begins on August 16th. The Return to Campus page has information on the timeline for the return to campus, tools for supervisors, and resources for employee support. Training sessions for managers will be conducted virtually beginning mid-July, and an email will be sent to all managers asking them to register for one of the available sessions. Training for managers will emphasize the importance of setting norms and expectations with their staff in the new way of working. Managers will prepare for sessions with their teams, discuss case studies, and will receive materials and tools that they can use as they implement hybrid work. I'm now going to turn it to Andrew for any questions that relate to this or anything else.
Thank you, Anne, and we've got a lot of questions. So the first one that I'm seeing come up quite a bit is the option about non-student facing staff only coming to campus 1 or 2 times a month. And folks wanted to learn more about why that option was removed from the list of hybrid modalities.
In the beginning, Andrew, I think when we were vetting the plan, people probably saw a plan without a core day. And it was through additional research and then really thinking about what we were seeing in the staff survey that we went to add the core day, and so that did create an opportunity for everybody to be here at least 1 day a week. So it was really taking folks' feedback into consideration before finalizing the plan, and the difference between the plan we vetted and then the plan we finalized. And the difference there is this emphasis and real need on the university's behalf to have a time starting in spring 22 at the latest where everybody does come in at least 1 day a week to build community, to get to know each other, to share information, etc.
Thank you, Beth. It was stated that hybrid modalities will begin on August 16th, but will supervisors or can supervisors require their teams to start earlier, or can staff opt to begin their new schedules earlier than the 16th of August?
I think we are thinking that most departments would start on the 16th of August. If there are others because of prep work, etc., that's needed, to get staff here earlier, please do. We ask the department head to reach out to us so that we're aware of that and we can talk about starting the modality sooner. But I think generally we're looking for most departments to be around the 16th of August.
Thank you. When looking at the different hybrid modalities, what is the balance between individual circumstances, job function, and responsibilities of a job? Is there a balance between the 3 of those?
I think the primary driver, the primary driver really is the job functions and the needs of the department. Like, what does the department need? How do they need to staff for that? What are the job functions using those criteria that Anne shared? I think the employee input comes in 2 ways. One, which days of the week would you come in? So certainly there's room for that to work along with your manager, with your department head, in terms of determining which days you would be scheduled. I think there could be some flexibility there. The other is we have heard, I might get hybrid modality, let's say 2, but because I have children at the Child Development Center, I want to come in 5 days a week because it just is better for me. And that's possible too. So there's always flexibility to request to come in more often than your modality may require. I don't know, Anne or Seth, if there's anything that you might add there, but that's how we have been framing it. It really is important to know that the driver for a lot of this will be like, what's needed in a department in order to staff appropriately. Again, we've never done hybrid before, and we've not done hybrid and had a lot of remote workers in cases where all of our students will be on campus at the same time, right? So this is a bit of a learning experience, and that's where we're asking for flexibility. We'll do an assessment to see how it's working. We do anticipate that people will fill out a new hybrid work arrangement form, like a telework form that we did before, and that there will be some process of checking in and possibly, as Anne noted, adjusting things after we get through the fall semester.
So I see that John answered the question in chat, but wanted to just draw attention that flexing or compressed schedules and folks who had those previously, or maybe new additions to that way of working, will factor into the hybrid modality. So those are still possible in the hybrid work environment. So thank you, John, for answering that. What is the role of HR versus individual units in managing individuals' hybrid schedules? So, for example, if I wanted to do a seasonal based approach to hybrid work where while residential classes are in session, I'm on campus 3 or 4 days a week and working from home the other time. And then over the summer, the winter intersession or things like that, I'm working from home more frequently. Is that something individual units can do, or does that require HR approval?
You know, we have created sort of the framework and the tools and the plan and the policy, which will be coming out. We'll have a formal policy for this. So that's sort of the HR responsibility, doing the overall review, ensuring equity. The planning itself and the decisions about how each AU position. So think about this at the position level. Everybody has a position, and the characteristics of that position drive what the modality is. Those things are the decisions of the department with our review and oversight. And so that kind of sticks with the position and carries forward whomever, fills that particular job. So can one flex, from, you're going to have a modality, right? And you're going to have some number of days that you would be coming to campus. Could that flex in the summer months to do more or less? Probably to come to campus more often, probably not to come to campus less often. But I think your question was, could I come to campus more often, right, in the summer months? So you would have the ability to flex up, and we don't anticipate there would be, without changing the modality, opportunity to flex down to come to campus less often, unless the needs of the department would change or the characteristics of the position would change.
Thank you, Beth. When it comes to student staff, are there any sort of HR requirements as to how they work in terms of hybrid versus in-person exclusively or remote exclusively, or is that up to individual supervisors?
And maybe you can, I know you're looking at the planning that departments have done so far, which is primarily, I think I focused on the full-time and regular part-time staff positions. But at some point we will have some discussion about the student workers too. You want to maybe cover this?
Yeah, that's correct. So our primary focus right now is on the hybrid modalities that were set for full-time and part-time positions. Part of the issue with the students is a lot of the student hiring happens in August, September. So we'll be looking at that more closely as we get, more toward, the fall semester.
Thank you, Anne. Switching gears to technology, what sort of IT equipment initiatives will be launched or expanded to support a hybrid work environment?
Yeah, Terry Fernandez was on our working group. And so while I don't have all the details, I think I have enough of a sense that they are working on different programs on a going forward basis. I guess, currently we each are issued one computer. And over time, those computers would be more laptop and portable than they are today. So I think there's an initiative to sort of look at how to establish a larger bank for purchasing laptops over time. I'm not sure that's where we are for this fall, for those very reasons Seth noted at the top of the webinar about resource constraints. But they are working on various IT programs, programming, deployment of resources that will, support certainly over time the hybrid environment. I would imagine that could include equipping, some conference rooms so that we can some be in person and some be patching in over time. Terry has talked about noise, sort of muffling earbuds and that sort of thing that you can use if you're in a common space or a shared space and you're both having a Zoom meeting, so that the noise isn't distracting to one or the other. sharing the space. So I know there are plans afoot. I would say watch for more resource and more information as we get closer to the fall semester.
Thank you, Beth. Looking at next source and out-of-state staffing and things like that, is August 16th kind of the deadline for when folks should be back in the DMV area?
With the hybrid modality starting in the middle of August, that would be our expectation as well, Andrew. And maybe Anne can talk a little bit about, if you are in this situation, how you go about exploring NextSource
Sure.
as the employer of record.
Sure. So if an employee is interested in being, working from outside the DMV, they should get approval from their department head to move to NextSource. And if there is a move to NextSource, they have a comprehensive benefit package. It's different from our benefit package, and particularly with respect to the retirement plan contribution, matched by the employer, and also the education benefits. There's also a 60-day waiting period for their benefit plans. And we do provide a lump sum, to cover the COBRA cost to stay in our plan for the, 60 days till the eligibility for NextSource works out. But the key messages are department head approval, and then working with my team in HR to get the transition to NextSource taken care of. If there's interest in seeing the NextSource benefits, it can be obtained through HR payroll help. And for other information, we would suggest that you refer to the out-of-state policy, which is located on the university policies page.
Thank you, Anne. Switching gears to think more about childcare, what kind of flexibility is there in terms of last minute changes to schedules based on changing childcare needs? Is there that flexibility? What kind of approval or extra layers are there to those kinds of requests?
I'll take that one. So I think, there are a couple things here. We have the Bright Horizons emergency backup care benefit, and that provides up to 15 days per employee per calendar year of care, either from a Bright Horizons center or in-home care, where the caregiver charge, the copay is $8 per hour. And they do have the ability to provide same-day coverage. So that's one option. Another option would be to work with the supervisor to see if, either the schedule can be adjusted for the day, or perhaps to take leave if that's not possible. I don't know, Beth, if there's anything you want to add.
No, I those were the things that I was thinking about too. Certainly we have to be realistic. Things happen, people for various reasons, caregiving or others will have occasion where the schedule just doesn't work for them. So if it's something a couple weeks or a couple days, there are the short-term adjustments, and then longer term, if different days of the week would be better accommodating the person's caregiving responsibilities, we would encourage you to work with your supervisor or to give us a call in employee relations for some assistance.
Thank you. Is there any flexibility on the August 16th date to match the first day of school for many public schools in the area? And what's cited there is that childcare is going to be difficult to find and maybe prohibitively expensive for just a week or two.
Let us, think about that. I would imagine, when do the public schools, et cetera, the district, Montgomery County, et cetera, start? I don't know that I sort of mapped that out myself, but something for us to consider. I think what we were trying to do, for obvious reasons, is to have everybody, give this a trial before our own semester begins here. And so, that's the driver, making sure everybody sort of tests this out. It's working okay for weeks, some before our students are here, and we get into the very heavy service period here, beginning at the start of the fall semester. but something that we will take under consideration and provide some guidance to the community about.
Looking at now some kind of miscellaneous questions. Are there plans to modify the dress code in any way for faculty and staff?
That question has been coming in, so we are going to be looking at it and considering, what that might be. Maybe some other or additional or clear guidance over what we have very little today, as a matter of fact, but everything seems to work fine. But I guess folks are looking for a more casual official dress code. Is that the thought, Andrew, going into the fall? Yeah. So more guidance coming on that.
Thank you. And these final two questions, I think, are more for Fanta again. Looking at events in particular, is there going to be a new policy or procedure in place when it comes to reporting attendee lists, thinking more of the contact tracing elements to event attendance?
Great question, Andrew. Yes, if we have events in particular that are including external guests, the folks who are sponsoring the events will have to register, would have to have almost like a registry with the name and information. They will be expected to keep that roster for a period of time so that in case of COVID cases that come up, that the contact tracing folks will be able to immediately access that information, and that we can have a coordinated effort with DC Department of Health on the follow-up that is needed. And so we will be providing specific guidance around that. That will be part of our event planning sort of guide.
Thank you, Fanta. And another question, will AU be encouraging more in the way of hybrid or virtual classes going forward as a permanent part of the curriculum?
I will let my colleagues in academic affairs answer that. I know in terms of larger conversations that we've had in terms of leadership team, we know that in terms of modality, we can expect that in higher education that there will be a shift to more hybrid models, in addition to those students who would prefer face-to-face. And so I know that's been something that I know as an institution we've been having questions about. And so I do think we can expect to see this notion of more hybrid becoming much more the norm as we move forward. How that will look and what will be the scope of that will be determined by our colleagues in academic affairs, clearly, and also seeing where higher education is going, of course.
Thank you, Fanta. And just looking at time, I think that is our last question. So I want to thank all of our panelists today for their very thoughtful and candid responses to these questions. We by no means got to all of the questions. So like I said, I've been tracking all of those, and we'll get the FAQs updated or at least clarified in some spots if it's needed. So to wrap us up, I'll turn it over to Seth.
Well, thanks, Andrew, for your very able management of the Q&A as always, and for all your work and input on our plans going forward. We hope this webinar was useful to all of you. It was useful to us to hear all your feedback. And as Andrew said, we will collect the questions because it helps us to know where there's areas that we need more clarification, where there's areas we need follow-up, as the panelists have reflected. Also, thanks to all the panelists and everyone who's been part of the team for planning on the workforce planning, on the health and safety. It has been a tremendous amount of work, and all the folks here and our colleagues who work together have done a terrific job. So thank you again. Please continue to share your questions, feedback through the resources that Matt identified, and we're looking forward to our return in August. So thanks so much.
Thanks, everybody.